day everyone. So my case study is all about 20-year-old man who having a severe borderline personality disorder. Hello everyone, I'm Kimberly May Belen from BSIE HE 3A. So, our content for this case study is introduction, date of confinement, diagnosis, background of the case, findings, conclusion, recommendation, and appendices. Let's start to discuss first the introduction of the case study. Let's discuss of what the meaning of the borderline personality disorder. This is a cluster B type of personality disorder, spectrum of diagnostic and statistical manual disorder. It is generally claiming its positive impressions along with multiple comorbid psychiatric conditions. This is the introduction of my case study. A 20-year-old man named Jacob, having severe borderline personality disorder, is briefly discussed here. The case of this man is presented here with massive depressive symptoms, self-mutilation, multiple suicidal attempts, bizarre antisocial fantasies, self-lacerating, depersonalization, irregular emotional stability, and exposure, along with self-harming, apathetic attitude with lots of guilt feelings. He was also massive anxiety and stress, self-doubt, a huge internal conflicts and pandemonium comprising abandonment, loneliness, failure, and resentment. There was a very poor adjustment with his widowed mother and also a deep longing as well as detachment from a fatherly-like figure. So, I will give you some idea, which is the borderline personality disorder comprises of 20% of the entire world population diagnosed with mental health issues with a lifetime risk for expression for one or more comorbid conditions to be 100%. Next is the date of confinement. Mental status examination on year 2017 to 2019 and a round of hospitalization of almost 5 times in 17 months. Along with outpatient therapy within 2 months, the situation massively deteriorated. He was immediately admitted to hospital. He was also hospitalized for almost 3 months. The primary reason was he had grown to be increasingly depressed, committed self-mutilations with a razor, and tried to attempt suicide. This was the first time he was diagnosed with major depression and borderline personality. This is the diagnosis of Jacob. A pervasive pattern of instability of interpersonal relationships, self-image and affects, and marked impulsivity, beginning by early adulthood and present in a variety of contexts, as indicated by 5 or more of the following. Number 1, frantic efforts to avoid real or imagined abandonment. Second, a pattern of unstable and intense interpersonal relationships and characterized by alternating between extremes of adulation. Third is identity disturbance, markedly and persistently unstable, self-image or sense of self. Impulsivity in at least 2 areas that are potentially self-damaging. Fifth, recurrent suicidal behavior, gestures or threats or self-mutilating behavior. Last is affective instability due to a marked reactivity of mood. The main idea of the diagnosis is that the borderline personality disorder persons often try to perverse the surrounding interpersonal relationships and his interactions with a variety of emotional deregulation and exhibiting instabilities of self-image and affects with markedly showing up rigorous self-mutilations and self-lacerations, imposed narcissism, impulsivities, delusional paranoia and hypervigilance, anxiety and mood disorders often in the depressive or major depressive levels with suicidal gestures or even multiple attempts. What was behind this unusual presentation in this young man who was tortured even by his fantasies for torture? Background of the case. The initial course of psychotherapy concentrated not on exploring the workings behind this fragile and fragmented ego, but rather on attempting to build a foundation for ego function by strengthening his coping skills needed for here and now issues, as he had essentially been unable to function productively for more than a year. Findings, he was also undergoing outpatient therapies with a combination of psychopharmacology as well as psychotherapies under contained and controlled clinical settings. He was advised ECT to decrease his symptoms and control his relapse so that he sounds well with the behavioral medicine. Within the short span of 2 months only, the patient was hospitalized. He was treated with both behavioral medicine as well as behavioral therapies. Conclusions and recommendation. Proposed characteristics for a generalist approach to treat borderline personality disorder are treat providers have previous experience with borderline personality, focusing on managing life situation non-intensively, that is once per week. Additionally, sessions are needed. Group and family interventions are encouraged when necessary. This case study is also presented in order to analyze an already documented psychiatric condition of a patient suffering from borderline personality disorder. Last is the bibliography of my case study. This will be the end of my presentation of my case study. And again, I'm Kimberly May Belen from BSIE HE3A.